Hi, everyone, and welcome. I am Glenna Davis. I'm a registered nurse and the CEO and founder of RX for Life, LLC. Prescription for Life is a health equity consultancy and education agency where we create employees who see employment as empowerment, employees who remain in compliance with anti-bias and anti-discrimination policies, employees who are willing to do the job they are hired to do. As a result, reducing acts of retaliation, which is the leading cause of employee lawsuits, as well as preventing burnout, the leading cause of America's public health crises. We specialize in advancing human health. I am a self-published author of Yet Here I Stand, My Journey from Bondage to Liberty, a memoir, and my latest release, Bias and Burnout, 10 Power Moves for Healthcare Workplace Equity, a healthcare business book. I have a 30-year healthcare experience, a 17-year nursing career. I have practiced in the areas of critical care, adult and pediatric, solid organ transplants, pain management, peri and post anesthesia. My passion is nursing. From the hood to the boardroom, your health is my business. Not so long ago, I almost lost my ability to create or earn an income because of burnout. I was attempting to cope with systemic racism in the form of systemic employment discrimination, a form of chronic job stress. There is where I understood that our ceilings, the US workforce, ceiling to true health is bias within the healthcare system, my beloved industry. More importantly, what happened to me during the time that I was facing discrimination within a major US hospital, those same things are still happening. It's happening to millions of other employees, which is why since 2012, I have been researching, developing, applying theory, writing, blogging, and providing services to clients and who are other gainfully employed persons working in healthcare in an effort to protect and improve their clinical outcomes so that they can continue to provide excellent healthcare to our nation's most vulnerable population, reducing health disparities. All burnouts are because of ineffective decision-making when dealing with systemic racism, corporate gains, profit before people. Do you know that people in want of employment rights are in constant state of chronic stress? And they deserve help from a healthcare provider who has overcome those same challenges and is the leader in reaching health equity. In our last video, I discussed, did I tell you what this video is called? I'm sorry. The title of this video is, what are the 5 challenges to dismantling systemic racism, part 2. Got ahead of myself there, people. Sorry about that. In our last video, I discussed, in no particular order, these are the 5 challenges that I come to understand in my own research and development and, interviewing other people, is that fear of retribution and acts of retaliation. And I listed those as 1 and 2. If you have not seen that video, I encourage you to take at least 15 minutes out of your day to watch it after watching this video. Because today we are talking about the last 3 challenges of dismantling systemic racism, which are ineffective decision-making, feelings of powerlessness, and internalizing public health issues as a personal problem. I do my best to go slow, unpack some of this, and keep my time because I definitely want to respect your time. I don't want to take too much of it. So, how is ineffective decision-making a part of a challenge to dismantling systemic racism? First, let's understand that any slights moral distress, and an awareness of any wrongdoing spikes the flight or fight system within any human being, right? And because this challenge is in the workplace, where people's identities and security and benefits and social circles and social standings are attached, they may be apprehensive to do the right thing. People know what to do, but they're afraid to do it because of being ostracized or maybe get blacklisted. They have seen what has happened to other people who has protested in the workplace. So they fear a risk of loss, right? However, choosing to do nothing or doing the wrong thing, which is the wrong thing I consider as being choosing a corporate interest over the humanity interest, because of fear, is what continues to feed systemic racism, hurting the communities that we serve, leading to burnout for our nation's healthcare professionals, and health disparities for lower socioeconomic people and vulnerable populations that we serve. Number two, feelings of powerlessness. Any employee attempting to cope with any type of employment discrimination, from onboarding to firing, leaves that employee grieved. That employee then is referred to a complaint process. Systems that are already in place to help a person, deal with their grief. And that employee is now at the beck and call of allies that are strategically in place for the organization who is doing the discrimination. A denial of rights is no excuse to not continue to pursue rights. However, there are restraints in place. Allies of organizations may not be aware of, well, I'm not even going to say they're not aware of, it's just that it's the process of what's in it for them. They have to get something to make money, right? This is always about money. You send someone to the employment assistance program, and because discrimination has always been taboo, they may not be in a position to validate the person's feelings, right? And they'll be like, oh, well, I don't see why you are not, getting the job that you're supposed to have. You seem to be qualified. No one pays attention to discrimination. And discrimination is a perceived issue, right? Which is why 2020 is such a unique time, because it's polarizing as well as magnifying. So no one can really ignore that racism is in play. We have heard it from the top immunologist, Dr. Fauci, that systemic racism is at play in what we're experiencing here in our nation right now, and particularly in our healthcare system, right? However, when I and tens of thousands, even hundreds of thousands of other gainfully employed people filed complaints of discrimination with their local Equal Employment Opportunity Commission, we suffered at the hands of systemic racism alone. I first experienced systemic racism where I had to go and file complaints of discrimination, maybe just after the late Christopher Dorner, and maybe during the same time. This is around 2012, Christopher Dorner, who was a former LAPD officer who had complaints of discrimination within the Los Angeles Police Department, as well as Khalif Browder, who was a young man who experienced discrimination in the judicial system and was put in Rikers Island, he did not want to confess to doing something that he didn't want to do. And as a result, both of them life ended in suicide. Khalif Browder took his own life, and then Christopher Dorner, suicide by cops, right? So it's important that we talk openly and honestly about how discrimination affects health and the organization's bottom line. It's more important to give allyship to those who are bold enough to officially complain. We could talk about how racism and how profit before people affects us all day long. However, unless we learn to protest about it in the workplace and take the risk of loss to do the right thing, because those who are like me know that you can't lose any good thing doing the right thing. It just feels bad. It feels like pain. It feels mind-boggling. It is mind-boggling. And it can lead to mental illness, and it can lead to physical diseases, which is why I created RX for Life, so that I can help educate and fill those missing pieces, fill that gap, so that we improve clinical outcomes and guide our health outcomes by understanding how to apply the truth and to remain in compliance with policy. So it's important for us to bring systemic racism from broad and abstract conversation to narrow and concrete, data-driven and measurable. There's where we will make progress, and those systems are in place using the Equal Employment Opportunity Commission, as well as people who are willing to officially complain and go through the process and be led through that process, so that they reach health equity, and so that communities attached to that person's complaint is also protected from the tail end of the systemic racism that she's trying to oppose. I want you all to know that RX for Life is equipped to help prevent stress-related diseases known as burnout. We are here about these 5 challenges, which are fear of retribution, acts of retaliation, ineffective decision-making, feelings of powerlessness, internalizing public health issues as personal problems. We want to provide you a solution, and we have 4 solutions right now ready to implement in our US healthcare systems. 5 challenges, 4 solutions to implement right now. So I'd like to invite you, if you are a healthcare administrator, to what everyone ought to know about equity and discrimination, thinking smart about healthcare. If you are interested in health equity, preventing burnout, decreasing health disparities, and reducing acts of retaliation by 30%, please email me. Go to my website at Your RX for Life, or click the link, or email me. I don't know where it's going to be, but the link will be there, or the actual address that you can go to. Let's begin a conversation so that I can see what your interests are and how I can help your organization. We do offer customized, we offer retaliation consultancy and customizable health equity plans for US health organizations. So please, I would love to have you in Thinking Smart, and I need to personally enroll you so that I can have a conversation with you and know exactly, what your interests are. So until next time, please be well.